As countries, health systems and payers seek to rein in rising healthcare costs, companies such as GE Healthcare focus on solutions that enable existing customers to maximize total cost of ownership, while also delivering new solutions and tools that build upon prior generation technology. In nuclear medicine, this capability opens the door for sites with the Discovery CT640 Pro, and now the recently introduced Discovery 670DR to upgrade to a breakthrough technology that represents the most significant advancement in SPECT technology in several decades: cadmium zinc telluride, CZT detectors. In this short video, the dedicated team at Barnes Jewish Hospital will share their experience and impressions on the upgrade of their existing conventional SPECT CT technology to the Discovery CT640 CZT.
Barnes Jewish Hospital is the teaching hospital associated with the Washington University Medical Center. It's a big hospital with nearly 1,400 beds and over 1,500 physicians, and it's one of the nation's premier academic medical centers. In April of 2016, we were lucky enough to get the first installation of a Discovery 670 CZT on our existing Discovery 670 Pro, and we were very pleased to be able to get that brand new technology into Barnes Jewish Hospital, first in the United States to have done that. The upgrade process was extremely painless. On Friday afternoon, a team of GE engineers showed up with the camera detector heads, and on Monday morning, all was well and working, and we were up and running with our usual acquisition protocols. The decision to upgrade this camera was really simple. With respect to the differences between CZT and sodium iodide detector technology, the key issue is that CZT is an entirely new approach. It's a solid-state detector system. It uses a direct collimation approach as opposed to what we have with sodium iodide detectors. It's got much higher energy resolution, better spatial resolution. We are using this camera for our basic nuclear medicine work first and foremost. We are using it for our cardiac imaging. We've been very impressed with the quality of the cardiac images. We use it for bone imaging and general nuclear medicine imaging with technetium and similar radiopharmaceuticals. But we've been very intrigued because of the much better energy resolution about the possibility of doing dual isotope imaging, and specifically the ability to image both technetium-99m and I-123 simultaneously. For example, a bone scan and an I-123 MIBG scan done at the same time, or parathyroid imaging with I-123 and technetium-sestamib at the same time.
There are several challenges that I'm faced with when I'm having to buy new equipment. One is obviously cost. The other part of it is installation time, and also getting the best equipment for the price. The next part of the decision is to make sure that the training quantity of time is going to be low, the reliability is going to be high, and that when my staff come in to use the camera and to do patient care, that everything is set up in a way that we can jump right into it. This upgrade option has been fantastic. For one, it only took 2 days to get the new camera into place. A lot of times it just takes 2 to 4 weeks to get a room prepared and prepped for putting a new camera in. But we did not have to redo the room. We did not have to send our staff for new training. And we really did not have to reschedule any patients either. It was a conversion that needed less time, less resources, less money, and at the very end of the day, you have a novel technology.
As the clinical team is taking advantage of the detector advancements, we've acquired lots of studies in list mode data to retrospectively look at it and see if there's a chance that we can lower the dose on the patients or cut the acquisition time to make the study faster for the patient. This camera has revolutionized how we do brain scans here at Barnes Jewish Hospital. In the past, we'd have to acquire the patient several times with motion, but with this camera, the head holder is fantastic. And with the added reach of the field of view as it goes all the way to the end of the crystal. And we've noticed with cardiac imaging that the patients are much more comfortable with their arms not having to extend as high up as in other camera systems we've had in the past.
I'm excited about the new CZT technology because it improves the image resolution, and this will allow us to bring to the clinic dual nuclide imaging and potentially improve the patient care. This upgrade has allowed us to implement new protocol, and this technology will improve the quality of the exam and the quality of experience of patients in our clinic.
Enabling a cost-effective upgrade path to access novel technologies not only serves the goal of improved clinical outcomes, but also addresses the financial challenges of healthcare delivery.